You know that we had a health emergency? Yeah, it's a health crisis. We on the road to universal health care? If so, what dangers could we face as other countries with universal health care like Canada are facing now? Sally Pipes, President and CEO of Pacific Research Institute and author of the Top 10 Myths of American Healthcare, A Citizen's Guide. Help me out on it, because everybody says that gosh, Canada, they've got, I mean, wouldn't you love to have the Canadian health service up there? No, not really. Yes. I kind of like ours. Tell me about Canada's health system.
Yeah, well, Glenn, you know, I am from Canada. I became an American 2 years ago, but I grew up under a single-payer government is the only provider of health care. And few people in America know that they have long waiting lists for care. In Canada today, the average Canadian waits 17.3 weeks, over 4 months, from seeing a primary care doc to getting treatment by a specialist. They have ration care and lack of access to the latest technology. So, you know, if that's what we want in America, then people should support President Obama's public plan, which will be part of an national insurance exchange.
Maybe just that people are waiting there because the doctors are so good, they just don't want to choose the bad doctors.
Well, Canada has a population that's very small, fewer than in California, of 32 million. There are 750,000 Canadians just on a waiting list to get a procedure done. And 5 million out of 32 million Canadians are waiting to get a primary care doctor. This is what happens when government sets a global budget and you have ration care and lack of access. And so, Canadians...
Sally, let me play the devil's advocate here. The other side will say, yes, but at least everyone can get health care. I mean, not everyone can have health care here. I mean, emergency.
Well, yeah, Glenn, you know, as Madam Chief Justice Beverly McLaughlin of the Canadian Supreme Court said in a decision on health care and the ban on private health insurance in Canada a couple of years ago, yes, Canada has universal coverage, but they don't have universal access to care. And that's what happens when you have these long waiting lists. You know, take a look at some...
I talked to somebody. I'm sorry. I did an interview today with Sky News over in Great Britain, and this guy was like, "You know, chap, we just love our health care over here." And I said, "Weren't you people drinking water out of vases at one of your hospitals here recently? They make our VA hospital, you know, that was rat-ridden, look like it's the Four Seasons. They're patient stacking in England. Does this health care system work anywhere? I mean, you don't have to get to the drinking water out of vases, which they really are in one hospital in England. You don't have to get to that point, but does it work anywhere where it is better than our healthcare system?
Absolutely not. Canada has, you know, if you take someone like Belinda Stronach, a former member of Parliament in Canada, when she opposed opening up the Canadian healthcare system to private medicine, yet when she was diagnosed with breast cancer, where did she come? Right to UCLA to have her breast cancer surgery done. And you know, you have clean...
This is the thing that bothers me, because everybody, the world leaders, they always come here. Anybody who's sick and wealthy or a world, they always come here. What does it mean for the rest of the world if we lose our position as the innovator, as having the best health care in the country, in the world?
Well, exactly. Silvio Berlusconi, the Prime Minister of Italy, if he listened to Michael Moore in his movie Sicko, he would have gone to Havana, Cuba to have his heart surgery done. But instead, he came here to the Cleveland Clinic, where the best heart surgery is done in the world. And I like to say, you know, Canadians have an escape valve. They just hop over the border and pay to get their MRI done timely. Where are we going to go as patients, and where are the best doctors in the world going to go if Obama's health care plan comes through? We have universal coverage. We don't have universal access. We will have a Medicare for all, single-payer, government-run system. It's not the American way, and it has to be slowed down.
Okay.
And people need to know in America, this is not what they will want if they want good health care.
Okay, Sally, I appreciate it. I do have an answer, by the way, America. Where will we go? To Cuba. He just opened it up. We can go to Cuba and get that really, really special health care where I bet there's a chicken that's walking down the hallway at the hospital. But that's just me.
And you have to take your own toilet paper and aspirin too.
And so Michael Moore might show up. It could be a sweet thing. All right. Thank you very much, Sally. Now, Friday we have a special show. It's part of the 912 project. Friday's program.